The anticipation of undergoing surgery before anesthesia was a horror-full act for patients. Cutting into the body to reduce sickness promised agonizing pain, and brought the possibility of infection, or even death. Earlier, a patient would be strapped or held down on the operating table by strongmen, but, throughout the procedure, surgeons could hear and sometimes feel the patient's screams and thrashing. Surgeons traditionally administered opium, liquor, or hypnosis to alter the patient's mind, rather than alleviate pain in the body. These methods brought their own dangers, either a weak effect or death by overdose. In some cases, ice was used to numb the area as much as possible. In any case, the patient had to decide how to handle the physical and mental trauma of watching their own operation. In his book Etherization with Surgical Remarks, Dr. John Warren of Massachusetts General Hospital remarks, "What surgeon is there who has not felt, while witnessing the distress of long painful operations, a sinking of the heart, to which no habit could render him insensible? What surgeon has not in these times been inspired with a wish to find some means of lessening the sufferings he was obliged to inflict?" The history of surgical procedures reaches back to the Neolithic and pre-classical ages. The first evidence of a surgical procedure is that of cutting a small hole in the head. This procedure was practiced as early as 3000 BC. The practice was widespread throughout Europe, Africa, and South America. In history, surgery was a painful process. Even if some natural remedies were used, they still had their limits. When we go through history, we can see evidence for Sumerians using opium poppy, Babylonians using henbane for relieving toothache, in India, Sushruta uses cannabis vapors to sedate surgical patients, and in the modern world, there occurred many inventions that tried to reduce, or eliminate the pain during surgery. In 1774, Joseph Priestley, an English chemist and natural philosopher, discovers airs of oxygen and nitrous oxide. He is the first to isolate oxygen. Later, the famous chemist, Humphrey Davy, in his researches, observes that, as nitrous oxide in its extensive operation appears capable of destroying physical pain, it may probably be used with advantage during surgical operations in which no great effusion of blood takes place. And in 1842, Georgia, physician Crawford Williamson Long became the first doctor to use ether as a general anesthetic during surgery, when he used it to remove a tumor from the neck of his patient James M. Venable. Ethers are a class of organic compound, which in its volatile liquid form having pleasant smell, and colorless appearance is used as an anesthetic. And finally, on October 16, 1846, William T. G. Morton made history by being first in the world to publicly and successfully demonstrate the use of ether anesthesia for surgery. This occurred at what came to be called the Ether Dome, at Massachusetts General Hospital on patient Edward Gilbert Abbott. In 1847, Professor James Y. Simpson, a Scottish obstetrician, begins administering chloroform to women for pain during childbirth, and the birth pain during cesarean became a history. Chloroform quickly becomes a popular anesthetic for surgery, and dental procedures as well. After chloroform, in 1956, Dr. Michael Johnston of UK clinically introduces halothane, the first modern-day brominated general anesthetic. It has been almost completely replaced in modern anesthesia practice by newer agents because of its shortcoming, partly because of its side effects. While giving anesthesia, there are inherent risks and drug interactions that are specific to each and every patient. The agents in widespread current use are isoflurane, desflurane, sevoflurane, and nitrous oxide. Nitrous oxide is a common adjuvant gas, making it one of the most long-lived drugs still in current use. Because of its low potency, it cannot produce anesthesia on its own but is frequently combined with other agents. Unlike the anesthetists of old times, who utilized a single agent like ether or chloroform alone for anesthesia, the present-day anesthetists use different drugs for specific effects. This helps them avoid using large doses of a single drug that was often required to produce sleep, lack of pain sensation, and muscle relaxation simultaneously. The later part of the 19th century also saw the development of anesthetics that could be administered through the veins as an injection, and machines that would continuously monitor the patient's vital parameters. The anesthetist could therefore, now, pick up changes in the patient's heart, pulse etc. and quickly take remedial steps if required. Advances and innovations in technology helped develop machines that could monitor not just the level of oxygen or carbon dioxide in the patient's blood but even the anesthetic gases used, so that the anesthetist can fine-tune the amount of anesthetic needed. Anesthesia today is safe, versatile, and indispensable to the patient. So, thanks for watching. Please don't forget to subscribe, and press the bell icon. Thank you. See you later.